Assisted suicide, also known as assisted dying or medical aid in dying, is suicide undertaken with the aid of another person. The term usually refers to physician-assisted suicide, which is suicide that is assisted by a physician or other healthcare provider. Once it is determined that the person's situation qualifies under the physician-assisted suicide laws for that place, the physician's assistance is usually limited to writing a prescription for a lethal dose of drugs. In many jurisdictions, helping a person die by suicide is a crime. People who support legalizing physician-assisted suicide want the people who assist in a voluntary death to be exempt from criminal prosecution for manslaughter or similar crimes. Physician-assisted suicide is legal in some countries, under certain circumstances, including Canada, Belgium, the Netherlands, Luxembourg, Switzerland, Germany, and parts of the United States and Australia. The Constitutional Court of Austria and Colombia legalized assisted suicide, but their governments have not legislated or regulated the practice yet. New Zealand legalized assisted suicide in a referendum in 2020, but it will come into force on 6 November 2021. The Parliament of Portugal passed the legalization of assisted suicide, but is now under consideration of the Constitutional Court in most of those states or countries. To qualify for legal assistance, individuals who seek a physician-assisted suicide must meet certain criteria, including having a terminal illness, proving they are of sound mind, voluntarily and repeatedly expressing their wish to die, and taking a specified, lethal dose of themselves. Suicide is the act of killing oneself. Assisted suicide is when another person materially helps an individual person die by suicide, such as providing tools or equipment, while physician-assisted suicide involves a physician knowingly and intentionally providing a person with the knowledge or means or both required to commit suicide, including counseling about lethal doses of drugs, prescribing such lethal doses or supplying the drugs. Assisted suicide is contrasted to euthanasia, sometimes referred to as mercy killing, where the person dying does not directly bring about their own death, but is killed in order to stop the person from experiencing further suffering. Euthanasia can occur with or without consent, and can be classified as voluntary, non-voluntary or involuntary. Killing a person who is suffering and who consents is called voluntary euthanasia. This is currently legal in some regions. If the person is unable to provide consent, it is referred to as non-voluntary euthanasia. Killing a person who does not want to die, or who is capable of giving consent and whose consent has not been solicited, is the crime of involuntary euthanasia, and is regarded as murder. Right to die is the belief that people have a right to die, either through various forms of suicide, euthanasia, or refusing life-saving medical treatment. Suicidism can be defined as the quality or state of being suicidal, or as an oppressive system functioning at the normative, discursive, medical, legal, social, political, economic, and epistemic levels in which suicidal people experience multiple forms of injustice and violence. Some advocates for assisted suicide strongly oppose the use of assisted suicide and suicide when referring to physician-assisted suicide, and prefer the phrase assisted dying. The motivation for this is to distance the debate from the suicides commonly performed by those not terminally ill and not eligible for assistance where it is legal. They feel those cases have negatively impacted the word suicide to the point that it bears no relation to the situation where someone who is suffering irremediably seeks a peaceful death. Suicidal people constitute an oppressed group whose claims remain unintelligible within society. Law, medical, psychiatric systems and LGBTQ scholarship. The wish to die of suicidal people and suicidal attempt are judged as irrational or illegitimate. It leads to an injunction to live and to futurity where suicidal people must be kept alive. Barrell uses the term suicidism to describe this oppression. To reduce the oppression of suicidal people, Alexander Barrell, a professor in social work, suggests to validate suicidal ideation as a legitimate experience and create a welcoming environment. To listen to their voice. Arguments in support of assisted death include respect for patient autonomy, equal treatment of terminally ill patients on and off life support, compassion, personal liberty, transparency and ethics of responsibility. When death is imminent, patients can choose to have assisted death as a medical option to shorten what the person perceives to be an unbearable dying process. Pain is mostly not reported as the primary motivation for seeking physician-assisted suicide in the United States. The three most frequently mentioned end-of-life concerns repo,